If you've been battling foot pain, knee pain, back pain, or even neck tightness, and no one can tell you why, there's a good chance the real cause has been missed completely. Here's the part that nobody talks about. An anatomical leg length discrepancy, also called an anatomical short leg, is not rare. When it does exist, it can quietly create years of chronic pain that no amount of stretches, massage, or adjustments will ever fix. This is exactly why you need to fix a leg length difference if you have one, and in this video I will show you how to understand it the right way. I've worked with hundreds of patients whose posture was literally collapsing, whose gait was uneven, and whose pain had lasted more than a decade. Through clear and objective analysis, we uncovered measurable leg length differences that, once properly corrected, permanently eliminated their pain and restored their ability to function normally again. In this video, you're going to learn the 4 steps that I use to determine whether you have a true anatomical leg length difference, whether it's the source of your chronic pain, and the right way to support it safely, effectively, and for good. And if you have been told back pain, neck pain, hip pain, foot pain is random, age-related, or just tight muscles, stay with me, because at the end of this video you will see real visual examples of patients who have corrected significant postural distortions and alleviated years of chronic pain simply by addressing their structural short leg. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario with over 25 years experience and a background in gait analysis, biomechanics, and neurology. My mission is to provide a thorough solution to the spinal problems that develop from an unlevel foundation, like anatomical short legs, spinal and pelvic misalignments, poor posture, and foot dysfunction. This channel is for people dealing with chronic back pain, like sciatica, neck pain, poor posture, and headaches, that are looking for real lasting relief. You'll get clear step-by-step strategies how to address the root cause of these conditions and start feeling better fast. Subscribe now for real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms so you know exactly what to do next. I upload a new video every week. Most people think a small leg length difference is no big deal. They think it's like having one foot a little bigger than the other. But an anatomical short leg is nothing like that. It does not stay local. It does not stay small. It affects everything above it. Here's what most people never realize. When one leg is structurally shorter, even by a few millimeters, your pelvis tilts. Your spine rotates to compensate. The muscles on one side of the body are forced to work harder every single step you take. And that tilt does not just cause pain. It starts a slow chain reaction through your hips, your lumbar spine, and even right up to your neck. Over time, the uneven load on the pelvis increases pressure on the lumbar discs, on the joints start to wear down faster on one side. The ligaments tighten unevenly, and the spine begins to degrade in predictable patterns. And this is why most people end up with degenerative arthritis, disc thinning, or early disc bulges, even without knowing the real cause. The body has been trying to level itself for years while the foundation underneath it stayed tilted. I see this every day with patients who've tried everything: physical therapy, stretching routines, massage, strengthening. None of it works because the foundation of the body is literally uneven, and the degradation continues as long as the imbalance stays uncorrected. And here's the part almost no one knows. When your posture shifts, your brain automatically engages something called the righting reflex. The entire job is to keep the eyes level with the horizon. So if your pelvis drops on one side, your brain will tilt your spine, rotate your shoulders, and adjust your head position to keep your vision straight. You don't feel this happening, but the compensation is massive, and your body will sacrifice joint health and muscle balance for decades just to maintain that visual stability. This is why you do need to fix a leg length difference, not because it's a leg problem, because the entire kinetic chain above it pays the price year after year until the damage becomes permanent. Later in this video, I'll show you real visual examples of how dramatic these compensation patterns become and how quickly they change once the correction's made. But first, you need to understand why most people never discover their leg length difference in the first place. Most people go years, even decades, without anyone noticing their leg length difference. And it's not because the problem is rare. It's because most evaluations never look for it the right way. Most of the professionals that people see for back or hip problems assess only the symptoms, not the structure. They stretch what's tight, strengthen what's weak, adjust what's stiff, but they rarely ask those areas why those areas became tight, weak, or stiff in the first place. And if your body's been compensating for a structural short leg, those treatments only manage the effects, not the cause. Another reason this goes undetected is that the compensations look completely normal from the outside. People think they stand straight. They think they walk normally. They think the pain is random. But the body's been hiding the imbalance through the righting reflex for so long that the posture looks natural even when it's not. And here's the surprising part. Even when leg length is checked, it is often done with a quick visual, guesses, table tests, or non-weight bearing scans. None of those methods can reveal a true anatomical short leg. This is why so many people get told everything looks fine when it's actually not fine at all. Later in this video, I will show you visual examples of what those hidden patterns actually look like and how the dramatic changes when the real cause is identified. But first I want to walk you through the 4 steps that accurately determine whether you have a true anatomical short leg. Now that you understand why an anatomical short leg creates so many problems, you need to know the exact process for identifying it correctly. There is a reason why so many people get misdiagnosed. If even one part of the assessment is incomplete, the whole picture is wrong. That is why these 4 steps are crucial. One builds on the next, and without all 4, you cannot get an accurate diagnosis or a proper correction. Here are the 4 objective steps we use in our office, and a brief explanation of why each step plays an important role. Not only the determination of an anatomical leg length difference, but also in the most appropriate way to deal with it. Step 1 is a thorough health history. Step 2 is a detailed postural assessment. Step 3 is a mobility and neurology examination. And step 4 is standing weight-bearing x-rays. These steps work together like pieces of a puzzle. The health history shows the long-term patterns, the posture exam reveals structural imbalance, and the mobility and neurology testing exposes the compensational strategies. The x-ray gives the final determination with regards to the best manner in which to proceed with correction. Miss any of these and you can easily end up treating the wrong thing. Get all 4 and you finally start to see the true cause of the years of pain, tension, distortion, and degeneration. Step 1 is a thorough review of your health history. This is where we uncover the long-term patterns your body's been dealing with. Chronic low back pain on one side, recurring hip tightness, knee pain that keeps returning, or foot issues that never fully resolve. These patterns are not random, rather they are clues that the body's been compensating for a structural imbalance for years. Without understanding your history, it's easy to mistake a structural problem for a soft tissue one, which is why this step is the foundation of an accurate diagnosis. This is also the time that we will discuss past incidents that may contribute to unequal leg lengths. Episodes such as falls, injuries, surgeries, infections, or fractures that may have occurred, especially in youth, and may have caused the growth plates in the legs to progress at an uneven rate. There are a multitude of reasons why this can happen, and we are thorough so we cover them all. Step 2 is a detailed postural assessment. This is where we look at how your body is actually organizing itself in space. We check pelvic height, shoulder height, spinal curves, and how your feet support you on the ground. If one leg is structurally shorter, your posture will reveal predictable patterns even if they look normal to you. This step is crucial because it shows whether the imbalance is functional or truly anatomical, and it tells us exactly how your body has been compensating over the years. Step 3 is a thorough assessment of your spine mobility, both active, which involves a determination of how you can move on your own, and passive, which determines how much extra spine mobility you have beyond what you can normally access. This is also where we test how individual joints move and how your muscles fire on each side of the body. When one leg is anatomically shorter, the nervous system builds long-term compensation patterns that you cannot stretch or strengthen away. This step exposes those patterns. It shows us which areas are overworking and which are underworking, and how your gait has shifted to keep you upright. Without this step, it's impossible to separate muscular tightness from true structural imbalance. These tests are critically important, not only to determine how well your nervous system is adapting to the imbalance, but also how well and how quickly it is most likely to adapt to any leg length correction that is implemented. Step 4 is standing weight-bearing x-rays, particularly the lower spine, pelvis, and hips. This is the final puzzle piece that will help us to determine the most appropriate lift height for your particular difference. Not from actually measuring the difference on x-ray, but by clinical experience to determine the manner in which your hip joints, pelvis, and spine have adapted to your particular circumstance and how much degeneration or arthritis has occurred. This part of the overall evaluation will allow us to make the most accurate determination of a lift height that will be the most beneficial for your particular situation. You now have a clear understanding of what an anatomical short leg really is, why it matters, and how to identify it the right way. Correcting or supporting a short leg can have a dramatic impact on your posture, your pain levels, and long-term health of your spine and joints. If you notice that your posture is uneven or your pelvis feels unbalanced, or you suspect or have been told that you have an anatomical short leg, get an appropriate evaluation with a qualified doctor who understands the process. The right assessment changes everything. If you found value in this video, like it and share it so we can bring more awareness to the real causes behind chronic pain that most people never get proper answers for. And if you have any questions, drop them in the comments below. I read every one. Remember to subscribe if you want real solutions for pain relief, better posture, and a clear understanding of what actually causes your symptoms. Watch the next video, especially if you are dealing with low back pain and want to see exactly how an anatomical leg length contributes to it.